Dr. Trokel, welcome to our center. It's a great honor for us to have you here today. You are a famous ophthalmologist, and you are the one who brought excimer laser in refractive surgery. I hope you took some time here in our center to familiarize yourself with our staff, with our techniques, such as Sutton's protocol, topography-guided PRK, and SMILE, LASIK. I think you also did some SMILE procedures on cornea transplants? Sorry.
Yes, I have certainly seen some extremely innovative, modern, cutting-edge technology applied to patients with significant diseases of their refractive system, and I find that the quality of the work is second to none, and the center sets the standards for innovation in corneal refractive surgery.
What is your experience today here in our center?
I saw a number of patients who had the SMILE procedure done. I saw a number of patients who had topographically guided procedures done. What was most interesting is seeing patients who have had corneal transplants and having a SMILE procedure done to correct the high astigmatism and the high refractive error associated in many cases with corneal transplantation.
Okay, and what do you think about our equipment in our center and about the staff?
I'm sorry, what do I think about them?
Yeah, what is your opinion, and what did you see here about our equipment and our staff?
I mean, it's hard for me to criticize when the lasers are the latest, the most modern, that the diagnostic equipment is comprehensive and complete and represents the newest technology that is available. And everybody appears not only well-trained but fully aware of the investigative procedures. They know exactly what's accepted and old-fashioned and what's new and innovative. And what, if you ask me, most impresses me is the attention to monitoring the clinical results. The use of the database that's been achieved to compare different technologies is how we learn and how we move forward. And that is hard extra work. You know, we do good for the patients, and we do good for patients when we treat him well with innovation, but we do good for all patients when we study the effects of the procedure and we report them to the world at large.
Today you had the chance to talk with Dr. Kanellopoulos and with the research team. How did you find the fact that our center is basically research-oriented?
I think it's a great compliment to Dr. Kanellopoulos that he's been able to organize such a technologically advanced and sophisticated research institute independently of other major institutional support. And I think of the complexities of innovation, of maintaining the equipment to the most modern technological equipment that's available, to maintaining a real-world database so you can assess the results of what you're doing. I think it's very impressive.
I know that you have traveled all over the world and you have visited many clinics and private centers. Do you think that there are some difference between centers in US and centers in Europe with our clinic?
Dr. Kanellopoulos is a very talented surgeon, and he makes these complicated and difficult procedures look easy. And it all starts from his skill set, and I think the Laservision Institute here sets a world standard that all can aspire to.
What do you think will be the future of the refractive surgery?
Well, I'd like to ask Dr. Kanellopoulos that because he has certainly worked some of the more modern techniques that I have used. And I think the future will be for greater safety, greater accuracy, and greater precision. Exactly how this will be achieved is not at all clear at this point, but the track record of the last 20 years shows that every innovation has made the surgical procedure more accurate and the surgical procedure more precise and the surgical procedure more comfortable for the patient.
Okay, thank you very much for your time, Dr. Trokel. I hope you enjoyed your time here, and we will be very happy to see you again in our premises.
Thank you.
Thank you very much.